Understanding dementia and delirium. Delirium. In this presentation, you will learn what delirium is, the signs and symptoms of delirium, risk factors and causes, how to assess, what to do when you suspect a person has delirium, and the duration and outcome of delirium. So what is delirium? It's a syndrome where an acute change in a person's attention, awareness and cognition occurs in people with a pre-existing neurological condition exists. For example, dementia, coupled with a precipitating factor such as an infection. So basically, it's an acute change in someone's condition, in their thinking processes, in their consciousness and awareness, in people who have a condition of the brain. And coupled with something that sets this off is often an infection. It's common in older adults who are hospitalised in general medical settings. So this means they have an underlying medical condition and they're also in an unfamiliar environment. So the person may present in either an almost comatose state or to being what we call hypervigilant or severely agitated. They may experience symptoms of psychosis, such as delusions and hallucinations, which are false beliefs or seeing things that aren't there, and they may experience altered mood. The person will be easily distracted, and they'll suddenly struggle to do something they might normally be okay with, such as walking, eating and drinking. They'll be more disorientated than usual and often experience an increase in their dementia symptoms more suddenly. The symptoms of delirium can fluctuate in how they present and how severe they are. So, as I mentioned earlier, delirium, you can have what's called hyperactive delirium, where the person's increasingly agitated, restless. They may actually respond aggressively, usually because they're very frightened and they're hypervigilant about their surroundings. Or delirium can present as a hypoactive delirium, where someone is unusually sleepy, withdrawn, very lethargic, and unable to focus on anything when awake. So it can present in two very extreme ways. So what are the risk factors? What makes people more prone to getting delirium? For a start, age. As the person's age increases, you're more at risk. If the person has dementia, or if they have cognitive impairment, changes in their thinking processes. If they're on certain medications like benzodiazepines or opioids. If they're visually impaired or hearing impaired, so they may not be actually understanding the environment around them so well because they're not seeing or hearing properly. Other risk factors include they may have multiple conditions, so they may have all sorts of things wrong with them, such as diabetes, asthma, epilepsy, all sorts of what we call comorbidities. People who are drug users are more at risk of delirium. If a person has depression, clinical depression, they're more at risk. When someone's frail, it all comes together really. If you have all these multiple conditions, you're more likely to be frail as you age. If there's been a previous history of delirium, the person is more likely to go on to develop it again. Poor nutrition, again, and dehydration. So if the person's not eating or drinking properly. So as you can see, somebody who has dementia, they're very much at risk of delirium. So what are the causes? It's triggered by multiple potential causes. That can include perhaps the person becomes acutely ill, perhaps they suddenly become ill with an infection, often a urinary tract infection or a chest infection. They may have some sort of trauma. Dehydration is a big risk factor, as mentioned before. So when someone's dehydrated, they may have what's called electrolyte imbalance. So they've got low salt and blood sugar levels. The person may be constipated, and somebody who has Lewy body dementia is much more at risk of all these things. And kidney disease. So basically their bodies are going into a state of toxicity. Liver and heart failure. So if the person's not taking in enough oxygen in the blood, as I mentioned earlier, drug use or withdrawal from drug use. If a person's had to have emergency surgery, usually emergency, then that might, when they come round from the surgery, they may become more delirious. It's very common after somebody's had a stroke. And there's a very high incidence of delirium in people who are receiving palliative care. People who are very, very ill, where all treatment has been stopped other than to make them comfortable. Seizures. So if somebody has epilepsy or is having strokes. If someone's in severe pain, that can cause delirium. And the severity of their condition. Say, for instance, they have sepsis, they have an infection. Sepsis can be fatal. Low blood sugar, stroke, liver failure. And actually patients who are in high dependency units who are ventilated, up to 50 to 70% of those patients will have experienced some form of delirium. And it's very, very frightening. Other causes then, outside of the person's body, are the environment. If the person's sleep deprived, if there's a lot of noise, if they're disorientated between night and day, which might be affected by their dementia. If, like in hospital wards, they may have had what we call invasive procedures, so they may have had drips put into them, they may have catheters put in, there may be monitors, lots of bleeping, lots of noise. If the person's immobile and they're falling. Also, if they're separated from family and familiar faces. Often a person, when they go into hospital, is really, really frightened. They don't recognise the environment and they don't have perhaps familiar faces around them. Being on multiple medications can contribute to delirium, and being on sedation too. So what do we do? Well, if we feel that we're seeing somebody who is becoming suddenly very ill, either very, very hyper vigilant or very more towards very sleepy, and it's different for that person, we need to seek medical help immediately. And then the medics will need to treat the precipitating condition. So they need to treat what's one of the multiple causes. So whether it's the infection, they'll need antibiotics. If there's an electrolyte imbalance, they will need intravenous fluids, and the person will need to be supported during their distress. And I would definitely recommend looking at our Understanding Moods and Emotions and Behaviours courses, because that will give you more tools to know what to do when somebody's actually experiencing delirium. We need to ensure a calm, safe environment. So again, we have a module based on this, how to look at our environment and the surroundings and how we can make that a better place for the person. We need to make sure the person is wearing their hearing aids and their glasses and that they're clean and in working order, so that we can optimize how they are sensing the world around them, because that can make people feel very confused if they don't hear properly or they're not seeing properly. A good sleep routine is really important if we can try and get that person back into some sort of sleep routine at night. And if the person is mobile, encourage moving around and gentle activity and fresh air. Think of all the normal things in your day-to-day life that they might be missing. It's also really important that we avoid moving the person unnecessarily in an unfamiliar environment. That's just going to contribute to their delirium. So what to do? We encourage daily orientation, help the person know where they are, what day it is, what time of day it is. early mobilisation, get the person up, moving around as soon as is possible and is safe, and get them involved in something therapeutic, some activities to actually help them engage in the world again. They may need assistance with eating and drinking, and it's really important here to involve the family where possible and keep a diary of the experiences and how the delirium manifests, how it shows itself, what happened before the person became delirious. It's really important to document all these things so that we can try and prevent it happening again, and also treat what's causing it. So how long does it continue? How long does delirium go on for? And what are the outcomes for people? It very much depends on the treatment and the person. Delirium is variable, with most episodes lasting a few days, but in 20% of people it may continue for weeks or months. And it is associated with poor outcomes. The more events of delirium that people experience, the more likely they'll end up being institutionalised, and even actually will contribute to their death. However, once the underlying cause is treated, most people can get better within a few days to a few weeks. But it often leads to a person staying longer in hospital. On discharge from hospital, their notes, care and support plan must record their delirium and describe what further support they will need in order to support them and reduce their risk of it happening again. A person may very well record memories of their delirium, and I know people who've been in intensive cares have spoken about this. They do remember the experience, and that can lead to feelings of fear and anxiety because they have no control over this. It's really important that a diary is kept of the person's experience, because it might actually also help them make sense of it when their condition improves. However, delirium may cause a permanent deterioration in a person's abilities, which will impact on their care needs, particularly when they have dementia. Sometimes delirium may uncover a person's dementia, but it's important to assess their cognition, their thinking skills, with a view to a potential diagnosis. So, say for instance, they've come into hospital and they don't have a diagnosis of dementia. It's really important when their delirium is subsided that they are actually assessed once they're fully recovered from that. So this presentation has helped you understand what delirium is, the signs and symptoms, the risk factors and causes, how to assess, what to do when you suspect a person has delirium, and the duration and outcome of delirium.